Okay, so Veterans in Mind is a new service, and it's working with military veterans who may be experiencing mental health and other difficulties as a result of their service in the armed forces. So the service operates across Cheshire and Merseyside, excluding Liverpool, and we provide a kind of a range of interventions, so addressing kind of psychological health issues through the provision of psychological therapy. And we also have a recovery coordinator who provides support with drug and alcohol issues and problems. And then we also work in partnership with Combat Stress and the Warrington Hub and SAMS, who then provide a wraparound service that will address issues that veterans may have around kind of social issues, housing issues, issues around debt, finances and employment. I think sometimes there's a misconception around the word veteran. I think sometimes people hear the word veteran and assume that that relates to an older person, and that image of an older person then maybe creates images and visions of people who have kind of served for years or decades in the services, in the armed forces. However, the definition of a veteran applies to anybody, male or female, who has served one day or more in any of the three armed forces, regardless of age. So Veterans in Mind does offer support to veterans using that definition. We estimate that around 20% of the UK population qualify as being a veteran, and we know that a large proportion of that 20% actually come from the North West. So we know that in the North West we are catering for a large population of veterans. We recognise that it can be really difficult to take that step to get help. We recognise that, if a person's feeling particularly anxious or particularly fearful, they're not sleeping well due to nightmares and flashbacks, they may be feeling very angry and not feeling themselves, not doing very much with the time, spending lots of time in bed, arguing with friends and family. We get just how difficult those situations are. And we also kind of recognise how difficult it is for people to take that step, take that first step to get help. The staff who work within our service are very much aware of how difficult that first step is. We try to make our referral pathway very easy and simple. People can self-refer, family and friends can refer, GPs can refer, other mental health services can refer. And the referral process can be a phone call, it can be an online form that people fill in. And then what happens is that we will contact the veteran by telephone and offer a kind of what we call a screening appointment. And that's just a conversation over the phone to see if the service is going to be suitable, if there's anything that we can offer to the veteran. And then we will offer the person a face-to-face appointment. However, again, we recognise that can be really difficult to do that, to come and meet somebody that you don't know, to talk about really difficult things that maybe you've not talked about for some time, or that maybe you've not talked about at all. So we then also offer telephone assessment. So if a person feels that they're not quite ready to take that step to meet somebody face to face, we would offer that support over the telephone, all the time preparing people and getting people ready for that face to face intervention and treatment. So the appointment, we try to offer appointments at a venue that's convenient to the veteran. We don't tend to offer home visits, and that's purely because we're a very small team and the geographical area that we cover is large. However, commonly we see people at GP surgeries, we'll see people at local veteran charities, for example the Warrington Hub and other hubs in kind of Wirral and across other areas. We'll see people at local resource centres, it might include libraries and actually at TA barracks. So it really does depend on where the veteran would be more comfortable being seen.